Sitting here with Dr. Mark Lobanoff, the man that changed my life forever. Thank you, sir. Really appreciate it.
You're so welcome. It's good to have you here.
It's good to be here. Back here only a few weeks after it, I'm seeing perfectly. I still remember when I came out of the procedure, and I was like, holy cow, this is amazing, right?
You were loud and proud. You stood up and let everybody know, I can see that. I can see the clock, and oh my gosh, this was quick.
Yeah.
So
it's amazing, and I think what's also amazing about it is how fast the procedure is. It's not, this isn't a long drawn out thing. This is a very simple, I mean, not simple from a complexity standpoint, but it's not that difficult on the patient.
That's right. And although nothing's rushed, it's a very efficient procedure. So really you're in there for a few minutes, you're done, and as you leave, as you're walking out of the building, you literally can see across the street. So you get this instant gratification, this instant result from what just happened.
Correct. And I mean, one of the things, since the surgery, I've had people come up to me, and I want you to tell the listener about the procedure a little bit itself, because I feel like there's still a lot of misconceptions out there. I was talking to this guy the other day, and he says to me, he's like, oh, how'd you like your procedure? I'm like, it's amazing, right? And then he's like, well, I don't know, I don't want any blades on my eye. And I'm like, oh man, like this is laser only here. Like, I don't know, can you talk about that? Is there a misconception in the industry still, or where's the blade coming from?
The blade comes from the technology where it was at essentially about 15 years ago.
Okay.
And a couple places in town still use that old, outdated technology.
Okay.
But really, the good LASIK centers, our LASIK center, uses all laser LASIK.
Okay.
So there's nothing sharp over them. There's no blade. There's nothing that's going to touch the eye. There's nothing that's going to hurt. Literally everything is done with laser light.
It's unbelievable. And then talked about the procedure itself. So can you get into just real briefly, like what actually happens during the procedure?
So the whole goal of the procedure is to use the laser and reshape the front of the eye and make it the right shape. So if you were born with an eye that's nearsighted or farsighted or has astigmatism, it's because the shape of that cornea is a little bit off.
Yeah.
The laser just corrects that. So it's just reshaping it, making it the right shape for your eye. And all that reshaping is done by a computer-driven laser with unbelievable precision.
That's awesome. And again, all that to me was just, yeah, I can see now. That's
right. You know, to boil it down to its simplest matters, it's a laser, it's reshaping the eye, and very quickly, literally minutes later, you can see.
Yeah, that's what happens when this is the professional version. I'm just like, yeah, I can see now. It's awesome. So that's what I like to say. Well, talk to me about how many people have you helped with this? How many procedures have you done? I know there's a lot of talk about numbers. Oh, well, how experienced. I mean, when you're the best and when you've done as many as you have, what kind of numbers are we talking about here?
Many, many thousands of procedures. So, at this point, I've probably done over 18,000 LASIK procedures.
It's unbelievable.
That's a lot of cases, a lot of LASIK. I've been doing LASIK surgery for over 14 years now. And a big difference in the training is I'm what's called a fellowship-trained LASIK surgeon. So most LASIK surgeons out there, they only go through a weekend training course and are certified to use the laser. Doesn't mean you're good at it, it just means you've been certified. A handful of us spend a full year at university training just in LASIK and corneal surgery. So that fellowship training is really unique, and only a few of us have that.
That's awesome. So, yeah. And with that experience, then, what is the main thing that people will say? You've done 18,000 of them. What do people say afterwards? I mean, are they just like, wow, I should have done this sooner, or this is super amazing? And I'm sitting here going, I thank you so much. I owe this debt of gratitude to you. I want to give you Christmas gifts or something like that. I mean, what do most people do? Are they like that? I mean, they're not stalkers like me, right?
No, you get a couple of stalkers. It's really the reverse of what you just said. For me, the day after I do LASIK surgery, and I see every patient myself that day, to me, that's like my Christmas morning, because I get to walk into the room and I get to see guys like you who they're just beaming, they're smiling. They say, you know what? For the first time that I can remember in my life, I can see clearly with no contacts, no glasses. And last night went fine. This is fantastic. I should have done this sooner. The best thing I've ever done. We love hearing those things. And when I hear that that's the result of what I did the day before, that's my Christmas morning.
That's cool. That's really cool. And then that's what it is, man. I mean, Dr. Lobanoff, I'm telling you, I'm still walking. I think I mentioned this to you. I'm still walking into my bathroom at night like, oh, I don't need to take my contacts out again, because literally, I think I was in 3rd grade when I first got glasses, and so we're talking something that you did for, or lived with for over 20 years. In some cases, obviously more, and it's boom, it's changed your life forever. It's amazing.
Yeah. And it's literally one of the few things that you can do for yourself that you benefit from every moment of every day.
Yeah.
Each night you're going to bed saying, wait a minute, I don't have to take these contacts off.
Yeah,
I see already, and I can just go right to bed. So it's a gift you can give yourself that essentially pays off every second of every day.
Oh man, and not to mention naps, or I mean, obviously, like if I fall asleep on the couch watching a football game, watching the Badgers beat Michigan at the Big House. I mean,
so at that point you're dreaming.
Okay.
I'm a Michigan fan, no, but yeah, the little things that you don't appreciate. You know, before, if you fell asleep on the couch and watching the game, you wake up and your eyes are sticky, they hurt.
Correct.
You've fallen asleep in your contacts. You say, oh, I know I shouldn't have done that, but now I'm paying the result of that price. LASIK, you get to put that worry aside. You know, you live your life without having to think about all these secondary things.
Unbelievable things. I mentioned this the other day. I took a flight. I took a trip, and you know, usually you have to have the little contact solution, like the 311 bottles, and so I have to go to the local you know, convenience store and pick up like a separate bottle of this and everything. I'm like, yeah, I don't have to bring any of that this time. It's amazing. It's so great. And then not to mention falling asleep on the plane, because that's what I do every time. And then I didn't wake up with blurry contacts, and I'm like, oh gosh, no. It's a life-changing type of thing, and it does affect you at all points in time. It's amazing. Talk to me about this. You mentioned, and be honest, now you have done many thousands of procedures, and you've done, you know, professional athletes, you've done television personalities, radio personalities. When you had Paul Thomas from Bob FM in your chair, were you nervous? Like, did your heart kind of, were you like, this is wow, you know, or not?
You know, for the first few years that I did LASIK, I would have that little flutter. But I've done so many of these fellowship trainings that, you know, I give every patient the same amount of attention. And fortunately, we have such great technology that I don't have to worry so much anymore.
Not nervous at all with Paul Thomas in your
I was a little more worried, not so much about the procedure itself, but the stalking afterwards. and sure enough, that's been the biggest problem.
That's been issues, no.
Yeah.
Well, anyway, I figured maybe, you know, maybe it was kind of a big deal for you, but obviously, like you said, you've kind of done a lot of, this isn't your first rodeo, as we'd say in the business.
You know, the scariest one was treating my mother-in-law, father-in-law. Because,
okay, yeah.
You know, the in-laws, if you don't get that right, that's a little more worrisome.
Yeah, because not only are you going to hear that on holidays, but pretty much on a daily, weekly basis. If something, if they're unhappy with what's going on.
That's exactly right.
Yeah, I love it. It's PT from Total Country Bob FM. We're sitting here with Dr. Mark Lobanoff from North Suburban Eye Specialist. Unbelievable. He's changed my life forever, and he can do the same for you. Take a look at it. 763-421-EYES.